you? I'm Lori at Sente. I am here with Dr. Joel Cohen, who will join us momentarily. There he is.
How you
Hi.
doing?
How are you? Good. How are you? It's so good to see you.
Good to see you, Lori. What's happening?
Oh, just enjoying the 105-degree weather we had here today.
It was hot here too.
How was it? How is it there?
It's beautiful. Honestly, you look at the mountains and it's so green, and then the snow caps are still there. It's gorgeous here.
That is gorgeous. Oh my goodness. I saw your video of you earlier out enjoying the day. So it's lovely. Nice. Well, thanks for joining us. I almost introduced you right before you came on. For anyone who's not aware, this is Joel Cohen. He is just a great friend of Sente for sure, and Cyspera, and so many people in dermatology. He's just a lovely human being, and we respect him so much for his work and his skincare education and his knowledge. So thank you for joining us today. Tell us, for people who don't know you, and I can't imagine that's the case, but tell us a little bit about your practice, where you are, and how things are going right now.
So I practice in metropolitan Denver, and we opened up about a month ago, just really for skin cancer patients. So we were closed for 7 weeks, and there were a lot of patients who had skin cancers that were scheduled. We did go into the office intermittently for urgent things like melanoma surgery, or to rule out a melanoma and use our dermatoscopes. And then really in the past couple of weeks, there's been people calling, fortunately, and asking about aesthetic treatments. And throughout this whole process, I think skincare remained pretty busy. So, for those of us who were able to do a bit of telemedicine, skincare was something that patients had a lot of questions about, what they can do in the meantime. These people were, obviously getting some outdoor exposure, and people were just so happy to be outside that a lot of people forgot sunscreen. And people came in, recently with sunburns or sunburns over certain parts of their face, or they didn't wear their hats, or melasma flares and things like that, which dovetails nicely with Cyspera.
Yeah. Have you seen, just, on that, with people, some people being inside more, some people being outside more, have you seen a big upswing in hyperpigmentation from people not really aware that you do need sunscreen all day, every day?
I've seen more melasma flares in the past couple of weeks than I think I remember seeing in many, many years. So, for a lot of people, they were really just indoors. And then when they started to be able to go out and do certain things, to the grocery store, the hair salon, or the nail salon, or just spend time with their kids on the driveway, they were just so happy to be outside again that, sometimes the last thought was, sunscreen, or they had somebody over that they didn't want to come in the house, and they met them on the driveway, and they stood out there for a few minutes talking longer than they had imagined, and they had no sun protection.
Yeah, that's what I always tell people. It's that 15 minutes where you just went out to check the mail and your neighbor is there, or you're walking the dog and you run into somebody or you're in the grocery store and you're walking across the parking lot and you see someone that you haven't seen forever, and that 15 minutes without sunscreen will get you every time. So just wanted to check that with you, though, because you are the expert, right?
Lori, I gotta say, I got a haircut for you. So I got a haircut today. My last haircut was February 5th.
Nice.
According to Gray Clips, and I was so desperate. Honestly, I would have gone to mediocre clips or satisfactory clips or it'll do clips, but I was able to see the guy that I usually see at Gray Clips, and it fortunately worked out.
Oh, thank goodness, because we wouldn't want you out otherwise.
I had a whole ponytail thing going. So Practical Dermatology and Modern Aesthetics did a quarantine hair little contest for me, and it was pretty special, I'll tell you. It was like,
I want to see those pictures. We want to see that. We want to see that. All right.
They're on my Instagram.
Oh, nice. I'll have a look just after this. So, talking about melasma, hyperpigmentation, and Cyspera, how did you first hear about it? What do you like about the primary ingredient in Cyspera versus some other modalities, and knowing that there's really a place for everything? It's just a matter of what's right for which patient.
So there's a lot of dermatology and aesthetic meetings, and over the years, a lot of times I've actually learned about a product or some specific ingredient at one of the European meetings or one of the Asian meetings. And, this was the case with Cyspera as well. So, the Monaco meeting, AMWC, and, other meetings that are in different places are in France or, anywhere. We have the opportunity, 5cc, to really see what people are using in other parts of the world. And that was the case with Cyspera. So I knew Gonzague, and I met Jeff along the way, and I tried some Cyspera, basically bringing the 5% cysteamine back to my patients. And it really did make a difference. And I think it really fulfilled a niche that we weren't catering to at that point. So, I think one of the things that's nice about Cyspera for folks who aren't familiar with it, it's short contact. So it still interferes with the pigment production pathway. It still has tyrosinase inhibition, but in terms of the way that it actually works, you just need it on the skin for 15 minutes or so. And, people can make that work. So, for some people, they wake up in the morning, they put it on because their face is already, clean. They don't wash their face before using it. That's one thing that really is hard for people. So, some people wake up, they put it on, they have their cup of coffee, they have breakfast, they wash it off, and then they put their topicals on, like Sente Dermal Repair Cream or Sunscreen, and then they go to work. For other people, they come home from a busy day at work, they wash their makeup off, and then, they wait an hour or so, and, they put it on, after dinner or something like that. They leave it on 15 minutes while they're, taking care of the family and doing things. And for other people who, may be taking a retinoid break in the evening, it is something that they can use where, they just put it on for 15 minutes before bedtime, and that's really about it. But it, really is a nice product to integrate into people's topical regimen. And, for some people who don't want a lot of steps, who want to come in for chemical peels for melasma or come in for, laser procedures for pigmentation, it's not that hard for them to integrate that 15 minutes.
Right. That's what I was about to ask you. How do you, with other ingredients like retinoids and glycolics, obviously there's a little bit more management that has to go into, how do I use this product if I'm having this treatment tomorrow? How much easier is it to actually to do that with Cyspera and the treatments that you're having and the other products that you're using?
Honestly, it's so easy just to find the time of day that really works for people, and that seems to be the time that they usually do things. I'm in Colorado. I just want to show my jersey because I'm really excited that the Avalanche will be playing again shortly, and they're going to start the playoffs in a few select cities. But Avalanche are a top-notch team this year, and I'm excited to at least watch them play on TV. So I wore my jersey for you right here.
Very nice.
Go Avs.
Very nice.
And
my Raiders hat is over here. I could have.
Oh, we don't like the Raiders here. Sorry, Lori.
Well, I know, but we have a stadium now, and we have to go. So there you go.
We're in Bronco country.
I know you are.
And Peyton Manning lives like right over there.
I like him. I went to Tennessee, so I'm a Peyton Manning fan.
Great. So in terms of I think it depends where we live, but in terms of Colorado, it's hard to get people to use retinoids all year, even if you're using a lower strength retinol. People have a hard time tolerating it in the winter. Just the lack of humidity and the forced indoor, and the fact that people are outside doing winter sports and it's cold. So, we try to find a retinoid that really works for people, that they will tolerate, that they'll be able to do. And at the same time, we find a helpful skincare regimen. But it's not just in the summer when people's melasma flares. I take care of a lot of people out there that board or ski, and they're out there for long periods of time at high altitude. We're getting more UV penetration. And, so Cyspera is a product that they can use all year. And this is an important time right now. A lot of times we take a little hydroquinone break. We don't let people use hydroquinone all year. We have them used for a couple months. And the most common months I typically have people use it are the fall. So with Cyspera, we don't have sort of those restrictions. We have not seen issues like we have rarely with hydroquinone, like exogenous ochronosis. And I think Cyspera really fits into the full complement of people's skincare regimen year round.
Nice. So for somebody that, is there like a specific skin type that does better with Cyspera? What do you tell people to expect when they first start using it?
Well, first, I think the majority of our melasma patients out there have had a very good experience with it, and people have liked it, and it fit into their skincare regimen. And it was a niche product where they weren't using anything like it in terms of short contact. And then, second, I've treated people of various skin types with it. Most of these people with more significant melasma are type 3 and 4. Sometimes we see a type 5, and they do quite well with it. And oftentimes, patients don't even realize some of the culprits of melasma in terms of, the pigment and hormones just being charged, so that even a little bit of sun exposure can really produce a lot of pigmentation in certain distributions like the forehead, the cheek, the upper lip. And people, as we know, historically have called it the mask of pregnancy, but we see it from people on oral contraceptives. We see it in people who are pregnant. So, I think for people out there, the most important things you can do, 1 through 10 are probably the first 8 are sun protection, hats and sunscreen. And then
Yeah.
what else are you going to do? You're going to use pigment correction products like Cyspera, like retinoids, like, vitamin C products out there. That there's a lot of very good products out there, and combination products, but we really limit the amount of time people are using hydroquinone. And, there are some procedures that really work well for melasma, such as chemical peels. And
Yeah.
this is a great complement to chemical peels, as well as some of the lasers that we do with low heat, like thulium lasers, 1927 wavelength. I use the Lace MD Ultra. There's Cyton has a brand new, the M Jewel, which is a 1927, and then Solta has their product as well.
Very nice. So how do you manage that in? So let's say that I need a laser treatment for, hyperpigmentation plus Cyspera. What is that? What would you tell me to do first? Because I wear sunscreen every day. What do I do first to prep for that?
I've seen you up close at many dinners and many different places, and you don't get that much sun, Lori. You're
Well,
really good
good
about sun
point. Good
protection.
point. But let's say that I'm a patient who does get a lot of sun and has a lot of damage.
So, honestly, a lot of time we spend in the room for melasma patients is really just counseling them on the importance of sun protection. Even intermittent sun protection is very important when people are driving, when people are out and getting the mail or doing, something on the driveway with their kids. As I said, that people don't really realize how much that accumulates to. And then, there is some data about sun exposure and not wearing sunglasses, increasing some of the hormonal pathways that rev up pigment production. So my wife is great about wearing sunscreen. She's a pediatrician. She's great about wearing a hat, and she's terrible about wearing sunglasses. I'm always reminding her to wear sunglasses. I buy her sunglasses. I get her polarized sunglasses, and then she's out for a walk and she's not wearing sunglasses. But that actually, is very important in terms of overall pigment pathways. But also very importantly, as a Mohs surgeon, I see probably 1 or 2 eyelid tumors a week. So, and it's important that we really get the sun protection message out there.
Yeah, and sunscreen all the way up and sunglasses all the way around. I like those big sunglasses with the big lenses and the wide sides, so that I'm protected all the way around. Those are my favorite. They're a little obnoxious, but I like them. A couple of questions that popped up here. Someone asked, do you peel when you're using Cyspera?
So, you don't really peel using Cyspera. Sometimes patients get a little bit of irritation. So when you first start it, I always tell patients there's a bit of a smell to it. I don't find it to be problematic. And anybody who does find it to be something that they just don't like the smell to it, keep in mind it's only on your skin for 15 minutes, and you can use it at a time where, it has a less chance of bothering you. Sometimes, I have a patient who said they just don't love the smell, and we've worked it out. So that's when she lets the dog out in the morning and she's outside and she's smelling the fresh air or whatever. But that's pretty uncommon, and people just need to find, a time where it really fits into their schedule. And, rarely we make adjustments like that.
Yeah, perfect. And then another person asked, do you pair any other products, specifically Sente Dermal Repair Cream, in a regimen with Cyspera?
So I'm a huge fan of Sente Dermal Repair Cream. We really have spent a long time educating patients about moisturization and hydration. And really, we're not looking for something that's really necessarily going to be overly moisturizing on the surface of the skin. We just want to actually help retain water, get the glycosaminoglycans and all the different water binding capacity below the surface of the skin, and help patients overall in terms of hydration as well. So, I think when you guys were able to really figure out HSA and to figure out how to make this heparan sulfate analog with the right polarity to penetrate into the skin, that's an important concept and a differentiating feature between other products. And then, in terms of also Sente Dermal Repair Cream, it's a great product in terms of it actually has been studied and tested to be non-comedogenic. So, oftentimes when patients have procedures in our office, we give them Sente Dermal Repair Cream to use post-procedure, because some of these procedures may be actually something where if people use heavy moisturizers, it may be acne prone. And I think Sente Dermal Repair Cream makes sense. And then your Sente Gentle Cleanser just won the New Beauty Award. So I'm on the New Beauty board over the past few years, and it's always exciting to see products that I know and know well and have been recommending for my patients for a long time win important awards, whether it's New Beauty or Allure or Elle. These are exciting things.
Yeah, that's a really good combination for us, with any procedure. Daily soothing cleanser, dermal repair cream, invisible shield, either the SPF 49 or 52, because they're both such nice, all physical formulas. So it's good to hear that you like it as well. What, prior to now, let's say in the last year, what have been some of the most common requests you've had from patients, big concerns, other than the ones that we've already discussed? What are the other things that patients come to you seeking to correct?
So, one of my main procedures is heavy laser resurfacing. So
Mm-hmm.
people who have very severe etched lines around their mouth, around their eyes, these lines are oftentimes significantly more etched than anywhere else on the face. So around the mouth, the eyes, and then sometimes the secondary smile lines. So, from a standpoint of what else we can do, heavy erbium resurfacing. I use the Cyton full field erbium resurfacing. There's a lot of folks out there that I've really learned to use it from over the years. And that is one of the mainstay procedures that I do on a pretty regular basis. And I have patients coming in to see me for that. It's heavy downtime. So it's, about 10 days, sometimes 14 days of overall healing. But even one treatment can make a dramatic difference. So, for people right now who may be interested in doing something, but they don't want to go to an office 3 or 4 or 5 times, I think the erbium resurfacing makes sense because it's one trip into the office. And then if you're home right now, doing a type of healing at home is something you can do. And from a telemedicine perspective, we can really check in with patients if they want and see how they're doing in the healing process.
Perfect. And so would you use once, either would you prep someone? Could we use to spread before that leading up to it, and then pick up with that again after for maintaining the results as they relate to pigment?
Yes. And I think physical sunscreens are important. You guys have some really nice sunscreen. You're tinted, in terms of iron oxide
Yeah.
and camouflaging is in sun damage is helpful. And, there's a few product lines that we carry in the office, and some people like things for different reasons. But really, as part of a product line, Sente has some really great products that you can use post-procedure and you can use as a maintenance all year round as well. And, sunscreen is a key component of that.
Yeah. Yeah. And I like ours a lot. I know Deepa mentioning here that ours with iron oxide are ideal for, obviously they're great for pigmentation because you need the physical to really protect you, from UVA and UVB. But also we know the iron oxide helps with blue light. And then we also have an ingredient in both of ours that, again, another layer of protection from blue light and environmental damage. So, we're huge fans of our sunscreens, obviously. Somebody's asking here, when can I start using Cyspera before getting a chemical peel?
So, I'm not a big person in terms of stopping anything like Cyspera before a chemical peel. I think, you're using it for 15 minutes. The irritation potential at that point is small, especially this time of year when you have a lot of moisture in your face. So I don't have people stop that before a chemical peel. If it's the winter and you're dry and you're using a retinoid, you may want to stop a day or two before that, but that's about it.
Very
So,
nice. Very nice.
and we're getting a couple questions on here in
Mm-hmm.
terms of where can you buy these
Yeah.
products.
Mm-hmm.
I'm happy to have you buy them at my office. AboutSkinDerm.com. We have an online store, and we carry multiple Sente products, from Sente's Gentle Cleanser to Sente Dermal Repair Cream to the Illumine eye cream to Sente's neck cream. So these are all important products, as well as Cyspera, which is scientists in combination with Sente's product. And that was brought over in the fall and has really been successful for you guys, right?
Yes, it's been incredibly successful. We've just been so happy with everybody's response to it, right? Your support of it, other physicians, and the fact that they truly believe in the technology. It's a fantastic product, to be able to see the improvement in the skin, without the peeling, without the dryness, without some of the other things that you see with different ingredients. Again, there's a product on the market for everyone, and there's a reason for every one of those products that exists. But we like Cyspera because it is, it's very gentle, but actually instead of drying the skin or causing peeling, it does sort of hydrate the surface of the skin a little bit, and just helps to control a lot of the processes that cause that hyperpigmentation. So we're huge fans of it, obviously. Let's see. Question: what is the number one procedure you recommend at your office to get ready for summer?
We do a lot of thulium laser procedures, and really, in terms of the wavelength, it's 1927. It's really enhancing the light reflection on the skin. It's really has no significant downtime. Patients are pink for like a half a day. They may feel a little bit dry, but your skin is going to actually look brighter. The sun and the light is going to reflect off your skin better. Hopefully you're wearing good sunscreen. In terms of overall feeling, it's going to feel smoother. And interestingly, thulium lasers are FDA cleared for precancer, so actinic keratosis. So, from a sun damage, from pigment, from smoothness to light reflection, as well as precancers, it's a good treatment to do right now.
Love it.
And lack of any significant downtime.
Oh, and that's the best part, right? That's where I am. The lack of significant downtime is the selling point for me always. Another question: can Cyspera be used on the body?
I honestly haven't used it on the body, with the exception of a bit in the deco area. I think, for many people out there who have been very good about sun protection on their face, unfortunately, they not necessarily have been as compliant on their chest area. So I think that can be used on the chest for similarly short contact. It may be a little bit more irritating, I've found, just because you don't have the same follicular structures and oil glands that you do on your face. So keep that in mind. But, use a mild retinoid a few nights a week. Use Cyspera from a short contact standpoint. And, some of the procedures we do in terms of 1927 wavelength lasers or even light chemical peels can be applicable here as well.
Yeah, love it. And then what about leaving it on for more than 15 minutes if your skin is resistant?
So I definitely have patients that leave it on longer, particularly in times of flaring, but it can be a little bit more irritating. I've had people, leave it on for 30 or 40 minutes and know that it's irritating. I've actually had people even try to leave it on for several hours, but usually after doing that, you're going to have, 3 or 4 days later, you're going to have some peeling and some dryness. It's not the best thing to do.
No, it's not. And what I always tell people is that, the instructions are the instructions for a good reason. And, like you said, I think you can err a little bit past 15 minutes, but don't get carried away, because it's all well studied and there's a reason for that. So like you said, a couple of hours is just probably not the best idea. Just put that out there. What other, go ahead.
So, someone's asking about intimate areas, but Janine Downey has actually been speaking about this for a long time. But, for intimate areas, people have used it for pigment reduction. And I think you guys have a case series on that. Janine's actually talking about that in Modern Aesthetics, I think, this month. So there are people out there who do use it. Similarly, it's short contact and it can be irritating. But that's actually the nice part about this, is it doesn't have to be on for very long, and it's not something uncomfortable. I think for some people in those areas, the alternative is really some chemical peels, which can sting and burn and be quite irritating in intimate areas. So that is an important differentiator here.
Yeah, yeah, very. What other skincare advice do you have for all of your patients as we head into summer?
You know, Honestly, keep in mind that we see a lot of skin cancer in this country, and while we're all happy to really, after these stay-at-home measures, be outdoors and spending time with our family and friends outdoors, we really need to practice sun safety. I keep a hat in my car, sunglasses in my car, and always sunscreen around, and reapplying sunscreen is super important. Married to a pediatrician and having kids, I'm always emphasizing the sun protection strategies. And even today I sent an article to their headmaster from school, just talking about sun protection and messages that we might be able to underscore over the summer.
Yeah, and I think that's really important. Like you said, everybody's excited to get back outside and they don't want to take that 5 minutes to throw on some sunscreen. So, I do mine first thing in the morning before I walk the dogs at 6:30, and then it's done, right? For a little while. And then one more question, does it help to lighten dark stretch marks?
I haven't found it to be something that I have implemented really well into an overall stretch mark regimen. And it's something to keep in mind. Many of the stretch marks I see are more acute. They have a little bit more redness in them. And we use pulse dye laser. We use non-ablative fractional lasers. Sometimes we very lightly use ablative lasers. But, I think if people have hyperpigmentation within the stretch marks, I think it's certainly something to try, and it doesn't have the issues in terms of, that we worry about when we use combination products that may have steroid in it, where you could actually contribute to the stretch marks simply from the steroid.
Love it. So when is your office completely back open now?
So we're seeing like a low flow. So we're really seeing patients at about 50% of normal. And honestly, from my perspective, I've been in practice since 2001. It's nice to stop, talk to patients, and you're in the room, and we have to wash our hands so many times. You wash your hand when you walk in. If you touch something before a procedure, you wash your hands again. You've got all these masks, you've got glasses, you've got shields, and all these different things on. So, and then, I think people are getting used to seeing that. I was at, Great Clips today, and, they didn't let anybody in. You had to wait outside. You put your name on your app, and then you had to wait to be called in. The first thing they do is have you wash your hands and, with the hand sanitizer, and then you keep your mask on the whole time. So I think it's becoming more commonplace for all of us to really see that.
I kind of like, and I was talking to somebody else earlier today, and they said that they like the fact that they have to slow down a little bit more. They take a little more time with their clients, but then they also have looked around in their business and wondered, why they do things the way they do, why they have certain things in their business, because now they don't have time to use it, or they've just re-examined what they're doing and how they're doing it because they have the time to do so.
I agree. And, it's a great time to really talk to patients about skincare as well. Sometimes people are in to see their physician and they're talking about procedures, what they did that day, what's next on the radar. And, sometimes skincare gets left to your staff, or sometimes it's not even covered at all. So, with these longer appointments, I think it's really helpful that we remember skincare, and we remember our discussions about not just sunscreen, but really taking advantage of the fact that patients have other goals in mind. We can treat pigment, we can treat pores and mild lines and wrinkles. So there's a lot of different things you can do, and many people are really, from all the hand washing and irritation, these hand sanitizers can be really irritating on the face as well, and people shouldn't be touching their face and rubbing the eyes, but there's some things that we can do to enhance the barrier.
Yeah, I think we've all realized how often we do touch our own faces and scratch our faces when we didn't realize it. So there you are. I lost you for a second.
No worries.
There you are.
All right.
There you are.
I gotta run.
Tell us
Thank you.
where we can find you. Tell us once again where we can find you if we want to make an appointment with you.
So About Skin Dermatology in metropolitan Denver. We have an office in Greenwood Village and an office in Lone Tree. And our website is aboutskinderm.com. And my Instagram is jcohnderm.
Perfect. Thank you for your time. We appreciate it so much.
Thanks so much, Lori. And
Yes, sir.
Cyspera has been a great product in our practice.
Thank you. It's good to see you, and thank you again.
My pleasure. Thank you.
Bye. Thanks. Bye.